Hi, I'm Andy Goldberg. I'm an orthopedic foot and ankle surgeon from London in England. I work at the Wellington Hospital and also a visiting professor at Imperial College and associate clinical professor at University College in London. I've been introduced to MagnetOs by Kuros Biosciences, and I'm interested in this as a technology because there's three predominant features that I think are really interesting. So the first one is, being an innovation guy, is the innovative step, which I think is sort of, to me, came out of serendipity, like great innovations. The biphasic calcium phosphate bone graft was placed into an autoclave, and suddenly they noticed a change in the surface topography, and that had a dramatic effect on the immune system and the way in which the bone grafts became effective. And that surface tomography is a bit like, if you think of an irregular surface called NeedleGrip technology, a bit like, I think of kryptonite in the Superman films. It's this irregular shape. The macrophages come and stick down to it, and they affect the osteoclasts and the osteoblasts in the way in which the bone graft works. So I think that's really interesting. The second benefit really is the handling characteristics. That's really important as a surgeon. When you place your bone graft into these nooks and crannies, you want it to stay where you put it. And when you irrigate, you don't want it to wash away. And that's really one of the biggest challenges with synthetic grafts, is that they do wash away. They get into the soft tissues, they cause a problem. And this one stays put where you put it and doesn't wash away. And I think for me, that's a really important characteristic that I haven't seen in many other synthetic products that are on the market. And the third, perhaps the most important one, is the evidence piece, because it's supported by strong clinical evidence. There's a level 1 study that actually looks at post-lumbar fusion. So this is a study, a large randomized controlled study from the Netherlands, where they took patients and randomized them to having MagnetOs versus autograft. And they packed that into the post-lumbar space, and then they looked after a CT scan after a year and showed it was not only non-inferior, but actually pointed to superiority of the MagnetOs over the autograft. And that has several analogies to foot and ankle. We often use a space where we're putting graft in and it isn't under compression, or it's under distraction even, and in those spaces I want to know that that bone is going to, or that graft is going to turn potentially into bone. And in this study, it was a non-inferiority study. They actually showed a trend towards superiority of the MagnetOs over the bone graft in filling these defects. And there's also a safety element to discuss, which has to be brought to the conversation. So when you're using human tissue, there's always a regulatory part of it. You've got to track the case, you've got to consent the patient, and that whole process actually is removed when you're using a synthetic graft like MagnetOs, which has no safety concerns. There's no human or animal tissues, there's no growth factors, and so it's safe, and it's got over 30-year track record of using calcium phosphate, which is well established in human use.